Mr. Jones, my name is Lexi. I'm going to be your student nurse today. Are you able to tell me your name and date of birth? He does, and it matches. And Mr. Jones, are you allergic to anything? He is not. Today, Mr. Jones, I'm going to be changing your dressing here. Per agency protocol, we change it every week, and so it is time to change it. Does that sound okay with you? All right. And because I need you to hold, because I am changing that dressing, I need you to hold your arm out straight and still. Are you able to do so? He says he is. If this was a child or someone may be confused, I would have an extra set of hands in here with me. So I'm going to first begin. I'll wash my hands again. And I'm going to be opening my sterile kit. Make sure I keep that sterile. Mr. Jones, because we're taking off that dressing, I need to keep it a sterile environment. Are you able to wear a mask today? All right, he says he is. I'm going to reach in, pull out a mask. If he was not able to wear a mask, I would have him turn his head away from the site. Okay. And now, Mr. Jones, wash your hands again. Because I myself am going to put a mask on. And I will wash my hands again. Alrighty, I'm going to measure now. I need to be 6 inches above your insertion site. And then from there, I'm going to be measuring the circumference. I'm noting that. And then I'm going to be measuring the line here. Perfect. The reason I'm measuring that, Mr. Jones, is because I have to check your baseline, and if those were to be a half an inch larger from what we have as your baseline, that could mean that you might have phlebitis or an infiltration. What I measured today matches what your baseline is. So I'm going to wash my hands again. And I'm going to put on gloves. Okay. So now I'm just going to take a look here at your site. I'm noting any redness, any edema, schistosomiasis, any drainage or approximation. Does it hurt at all when I palpate? He says that it doesn't. So then I'm going to go ahead and remove the dressing. I'm pulling it down towards the insertion site. If this were to be someone elderly, I could use alcohol swabs to help pull it off better. Especially with people who may be more prone to their skin tearing. Again, I'm pulling that dressing upward and towards the middle. Are you doing okay, Mr. Jones? He says he is. This is where an alcohol wipe might come in handy. So I'm going to throw that away. Alright, so now I'm going to peel this upwards. Just going to hold down here. And then I'm just going to note, looking at the drainage, noting the color, the amount, the consistency, and if there's an odor, which there's not. So I can go ahead and throw this away. And now I'm just going to assess without touching what the hub looks like and the insertion site. Again, noting any redness, edema, schistosomiasis, drainage. Everything looks great. And the note, of course. So that all looks great. So now I'm going to remove my gloves and become sterile. I'm going to wash my hands. I wash my hands again because I touched that. Take the sterile gloves out. Carefully rotating these around. Alrighty, now that I have these on, I'm going to go and grab my alcohol wipe. And I'm going to grab the tweezers. Because I touched that, I would restart with a whole new kit. And then I'm going to grab here. And I'm going to go in a circle motion. All around, making sure that I'm cleaning any drainage that was there. And then I'm just going to set that aside. And I'm going to reach in and pull out another cleaning technique. I would squeeze this and activate it. And now I'm going to be applying friction for 15 to 30 seconds, really making sure that we get this cleaned. If this was someone elderly, I want to apply as much pressure. Alrighty, so it's been 15 to 30 seconds. I'll drop that. I'm going to make sure it's completely dry. Once it is, I'm going to reach in and grab my skin prep. And with this, I'm going to be making just around a square edge. Again, making sure that it's perfectly dry. If it wasn't perfectly dry, it could cause irritation and redness. So go ahead and throw that away. Because I touched my glasses, obviously I'm not sterile, so then I would restart. So now I'm going to get out the new dressing. I'm going to peel this off, making sure to only touch the outside edges to remain sterile. Again, I can't touch that because I'm breaking sterility, so that wouldn't happen. Placing that on as straight as I can, and then peeling off the edges. Oops. Wants to not come off very smoothly. Alrighty. And then I'm going to use a piece of tape with my initials and the date on and secure that. As well as I would replace the hubcap depending on my emergency protocol. That's all done. I'm going to remove my gloves. I will wash my hands. Now at this time, Mr. Jones, if you want, you can take your mask off. He does. I would take my mask off. Again, between both of those and taking on and off, I would wash my hands in between. From there, I'm going to ask if he feels safe and comfortable. He does. I don't notice any reactions happening, so I'm going to go ahead and document. I'm going to document the date, the time of when I put the dressing on. I'm also going to document my measurements that I took today and any of the inspections that I did of the site and the dressing.